Hello dear students, welcome back to my YouTube channel Physiology Learning. So in this video we are going to continue with our ECG series, and this is the last video in the ECG series, that is the electrolyte abnormalities. Some of the electrolyte abnormalities show classical changes in the ECG, so it is important to identify them so that it can help to treat the patient as rapidly as possible. So there are three major electrolytes which can cause significant changes in the ECG. They are, that is the sodium, the calcium, and we have the potassium. So out of this, the most significant changes in the ECG can be seen with changes to the potassium ions. So we'll discuss it at the end. So first, coming to the sodium ions. Sodium ions, even though it can influence the ECG, but it does not cause significant changes. For example, hyponatremia. Hyponatremia means there is a significant reduction in the sodium levels. It generally causes decrease in the amplitude of the waves. It generally causes decrease in the amplitude of the waves. Whereas hypernatremia, what it is going to do is, it is not going to cause any significant changes in the ECG, because most of the times sodium has this tendency to bind with the water, so that there is not much of influence on the channels which are present. Even though sodium channels are there, but sodium is generally bound with the water. So until and unless any stimulus happens, the sodium entry is not significantly seen. So hypernatremia, there is no significant changes in the ECG. So this is sodium levels, and is not influencing, of course, the ECG that much. Next, coming to the calcium and potassium. Calcium and potassium, all of you have already taught about this, the action potential. As you can see in this figure, the action potential of a ventricular muscle is given, and in the below, the surface ECG recording is overlapped with it. So why is this important is because we can identify which ion will influence which segment of an ECG. As you can see from here, the calcium entry happens during the plateau phase, which we have discussed in the action potential chapter of ECG. Then this is mostly corresponding with the ST segment. So this is mostly corresponding with the ST segment. So whenever there is a significant change in calcium, the first region that is going to be affected is the ST segment. Of course, if the ST segment is affected, then naturally it will influence the QT interval also. QT interval is also affected. Whereas coming to the potassium, of course, potassium involves in the rapid depolarization as well as the plateau, but significant potassium changes are required for the repolarization phase, wherein there is a potassium efflux. So it is mostly corresponding with which wave? It is mostly corresponding with the T wave changes. So your potassium level changes. Where do we look for it? First in the ECG. Of course, it can influence the other waves also, but first it will influence the T wave. So these two concepts you have to remember, so that the changes in the ECG can be easily predicted. Next thing is, what will happen whenever there is a hypocalcemia? Whenever there is an hypocalcemic levels, there is prolongation or an increase of ST segment. So if the ST segment is increased, naturally the QT interval, that is the increase in QT interval. Because QT interval is comprised of the QRS complex as well as the ST segment. So that's why it is going to be increased. QT interval. Then hypercalcemia, the reverse will happen. There is a decrease in the duration of ST segment. What will happen to the QT interval? Obviously, there is a decrease in the QT interval duration. Calcium levels can cause significant changes, but still it is not as dangerous like a potassium levels. So last, coming to the potassium levels, it is very important in a patient, in every patient of any hypo as well as hyperkalemia. The ECG changes are very important because they can cause severe arrhythmias if untreated. So they can produce severe cardiac abnormalities in comparison to any other ions. So first, coming to the normal ECG is depicted here. Then where will we start looking for the changes? Of course, whenever there is hyperkalemia, what will happen? The T wave generally tends to rise in its amplitude. So first, whenever there is a hyperkalemia, what is going to happen? The T wave is going to increase in the amplitude. This is also called as tall tented T waves because it is very tall and it is tented. And generally it is more steeper. This kind of tentedness will be there. So tall tented T wave is the first finding that will be observed. Why is it happening is because the extracellular potassium is available more, so the potassium inside will not be able to travel outside. So naturally the height of the amplitude of the waves starts to increase. Then coming to the further changes, as you can see here, this is a tall tented T wave. Then next what is happening is there is a widening of QRS complex. There is a widening of QRS complex. Will we see these changes in all hyperkalemic patients? It depends on the level of the hyperkalemia. So in case of a mild hyperkalemia, there will be only tall tented T waves. And if it is further severe, then there will be widening of the QRS complex. And if it is very severe, in case of severe hyperkalemia, as you can see in this image, here there is an absent P wave. So what hyperkalemia generally does is slows down the heart. It actually causes a lot of diastole and sometimes the heart will stop in diastole. And these hyperkalemic changes, they can cause arrhythmias easily. So hyperkalemia has the highest potential to cause arrhythmia out of all the electrolyte abnormalities. So they can cause arrhythmias also. So these two pictures are depicting the hyperkalemic condition. The below one, if it is hypokalemia, in hyperkalemia we saw tall tented T wave. In hypokalemia, the T wave will be absent. It can be isoelectric or it can be depressed also. So this is the condition of hypokalemia. So as you can see here, what is happening to the T wave? Here it is touching the isoelectric line. It is flattening. It is flattening of T wave is happening. If it further increases, what will happen? There will be a depressed T wave. There will be a depressed T wave. So this can happen. Then if it is further severe, there can be appearance of an U wave. Plus appearance of an U wave can happen. So these are the classical changes in hypokalemia. In case of severe hyperkalemia, what it can happen is one more finding is finally the waves will become something like a sine wave pattern. So this type of wave also can be seen in the severest of the severe hyperkalemia. So this is also called a sine wave pattern. And both hyperkalemia as well as hypokalemia can cause arrhythmias. So it is very important whenever we are suspecting an ECG abnormality due to electrolytes, then you should start looking for these findings in these patients and try to treat them as early as possible. So I hope it's clear. If you have any further doubts in ECG, kindly drop it in the comment section. I'll be happy to make a video on it. Thank you for watching. Stay tuned for more such videos. Thank you so much.